We're doing this because we firmly believe in when we find a professional who does something that, in a fantastic way, that we thought they deserve to have credit and they deserve to have a full evaluation to tell the rest of the world what's actually going on. In my case, and I have had, let's see, 3 surgeries from Dr. Tony Mork. I was in a car accident 20 years ago, and then after all that time, I started to get neurological symptoms, and that's how I sought him out. I had first cervical surgery. It was a laminectomy. I had 3 of them, and they all turned out beautifully. And what was absolutely startling was that not only that they worked beautifully, but that the recovery process was just about, it was so minimal I couldn't believe it. And just no problems afterwards. And that was a few years ago. That was in 2007, 2008. And then just recently, the most recent, this being December 2013, I had work done on my, which is trickier, on the thoracic spine. And it was yesterday. And here I am. Came back to the hotel, slept a little bit, and walking around. Took a 2-mile walk this morning, and was taking some naps today, taking my pain pills, things like that. But the pain is pretty minimal because of the quality of the work. He explains everything. He is. We run a tutoring company, my wife and I, and this guy not only does a beautiful job, he also explains things in advance. So you are completely knowledgeable and comfortable. The staff is just can't be beat. The hospital he practices from, the staff can't be beat. And as much as one would want to avoid spinal surgery in general, if you have to have it, this is where to have it.
Even though I was in the same accident Rick was in 20 some odd years ago, we're all different and we all sort of progress in different ways for whatever reason. But right about the time in July or June of this year when Rick was getting ready to have surgery on his neck for a different region, I started having similar symptoms to his, with numbness in my left hand and weakness in standing and trying to write, just a lot of pain up and down my arm. And so when we came out for Rick's surgery, I had Dr. Mork go ahead and do an MRI and evaluate my neck issues, and he found stenosis in the C4-5 region, I believe. And so he went ahead and did surgery the next day on me, and then after that on my husband. And so we both recovered together, which was interesting. I could be much more empathetic. But what was most interesting was there wasn't a lot of need to be empathetic because the recovery is so quick. Probably the worst part is you feel so good so quickly, you forget that you need to take it easy, not lift things, and not do the thing. You really need to take it easy for about 6 weeks, and you get fooled by that, and I tend to overdo things anyway. So that's been my difficulty, and I certainly wouldn't say that's Dr. Mork's fault. He's very clear about, hey, take it easy, give it 6 weeks, give it a little bit more time. But the surgery is just so incredibly minimal in its invasiveness that it's a very quick recovery overall. Just got back to work within a week and just back to most everything that I would be normally doing, save heavy gardening.
Would you say that one of the main problems, though, is that it's so minimally invasive that you're tempted to overdo it too soon and not follow orders?
Yes, I would definitely say for somebody like me, one has to be cautious. But I'm now more multifaceted. I can turn this way and it's much easier. I can turn this way, it's much easier. I can lift my head up like this, much easier. Not perfect, but better. And so I know that I can maybe have that treatment for a while before I need to do anything more invasive.
Yeah.
So I'm quite happy.
And I've got 6 weeks to go before I can resume my Olympic quality powerlifting. But I can wait that long. This morning, just the next day after surgery, we're in our hotel now. We walked 2 miles this morning to get breakfast, and it was completely fine. No pain, and actually helped. It sort of freed up the muscles a little bit, and we're back here, and things are going great. The next day after thoracic
Less
surgery,
than 24 hours
right,
after surgery, since it was
and from what I understand, cervical isn't quite as bad, but thoracic, and you are walking around the next day, it is just miraculous.
Now turn around just so you can prove
Well, you can't see anything. Okay, here's my cool